The importance of recognizing the need for caregiver support as we age. It's natural for our needs to change. And sometimes these changes might require additional support. Recognizing the signs that your loved one needs a caregiver is crucial for ensuring their well-being and safety, while also providing peace of mind for you as a family member or friend. In this video, we will discuss 10 common signs that may indicate your loved one requires assistance. By understanding these signs, you can take proactive steps to address their needs, whether through in-home care, assisted living facilities, or other support systems. Remember, seeking help is a sign of strength and care, not weakness. Here are 10 signs your loved one might need a caregiver. Number 1. Struggles with activities of daily living. The first and most obvious sign that someone might need a caregiver is when they begin struggling with activities of daily living, or ADLS. ADLS are essential everyday tasks that many of us take for granted, such as getting dressed, bathing, using the restroom, eating and walking. If your loved one is having difficulty performing these basic tasks, it could be an indication that they need extra help. This might include dressing, fastening buttons, or tying shoelaces. They may need assistance with mobility, getting in and out of bed or a chair, or require help with toileting or incontinence care. Notice if they're having trouble completing these essential tasks. It may be time to consider bringing in a caregiver. No. 2. Forgetfulness and memory loss. Forgetfulness and memory loss can be concerning signs that a loved one might need additional support. While occasional forgetfulness is normal, more significant memory issues might indicate underlying problems such as Alzheimer's disease or other forms of dementia. Signs of memory loss include frequently misplacing items, forgetting appointments or events, repeating questions, and struggling to recognize familiar faces. These symptoms can affect not only the individual's well-being, but also their safety and ability to manage daily tasks independently. If you notice these signs, it might be time to explore options such as in-home care or assisted living facilities that offer specialized care for individuals with memory impairments. No. 3. Unexplained weight loss or poor nutrition. Significant weight loss or poor nutrition is another indicator that your loved one might need extra care. As we age, our metabolism slows down, and it's common to lose a small amount of weight. However, unexplained weight loss or a sudden change in appetite could signify underlying health issues, difficulty preparing meals, or a decline in overall health. Similarly, poor nutrition can result from a lack of appetite, difficulty cooking healthy meals, or inability to access nutritious food. These issues can lead to malnutrition, which can further deteriorate physical and mental health. If you notice your loved one is losing weight or not eating properly, consider reaching out to healthcare professionals or caregiving services for support. They can help assess the situation, provide guidance and resources, and potentially assist with meal planning and preparation. No. 4. Mobility challenges. Mobility challenges, such as frequent falls or difficulty walking, are concerning signs that your loved one might need additional support. As we age, our muscle mass and bone density can decrease, making falls more likely. Additionally, conditions like arthritis, osteoporosis, and balance disorders can contribute to mobility issues. These challenges not only affect the individual's independence, but also increase the risk of further injury or hospitalization. If you notice your loved one is struggling with mobility, it might be time to explore options such as physical therapy, assistive devices, or home modifications. Occupational therapists can also help by assessing the home environment and suggesting modifications that can improve safety and accessibility. Number 5. Declining personal hygiene. Declining personal hygiene, such as not bathing, Brushing teeth or changing clothes regularly can be a sign that your loved one needs additional care and support. Maintaining good personal hygiene is essential for health and well-being, and difficulties in this area could indicate underlying issues like mobility problems, cognitive decline, or a lack of motivation. Neglecting personal hygiene can lead to skin problems, infections, and social isolation. If you notice your loved one is struggling with personal hygiene, consider reaching out to healthcare professionals or caregiving services. Home care providers can assist with bathing, dressing, and other personal care tasks, ensuring your loved one stays clean and comfortable while maintaining their dignity. Number 6. Emotional changes. Emotional changes, such as increased isolation, sadness, or mood swings, could be signs that your loved one needs additional care and support. As we age, it's natural to experience some emotional changes, but significant shifts in mood or behavior might indicate underlying issues like depression, anxiety, or loneliness. Social isolation can also take a toll on our mental health, leading to feelings of disconnection and despair. If you notice your loved one is experiencing emotional changes, consider reaching out to healthcare professionals or mental health services. Therapy, counseling, or support groups can provide the necessary help and resources to navigate these challenges and ensure their emotional well-being. No. 7. Missed medications. Missed medications or confusion about medication schedules and dosages are signs that your loved one might need additional support. Managing multiple medications can be challenging, and missed doses can disrupt treatment effectiveness and potentially lead to complications. Several factors can contribute to missed medications, including forgetfulness, cognitive decline, or difficulty organizing daily tasks. If you notice your loved one is struggling with medication management, consider implementing strategies like pill organizers, medication reminders, or utilizing technology to track dosages. You can also reach out to healthcare professionals or caregiving services for assistance in creating a medication schedule or exploring options like medication delivery services. No. 8. Clutter and messiness in the home. While many seniors prefer to maintain a clean and organized home, some may begin to struggle with keeping their living space tidy and clutter-free as they age. This can be due to a variety of factors, including mobility issues, cognitive decline, or a lack of motivation. A cluttered or messy home can pose safety hazards, such as fall risks from tripping hazards or the buildup of flammable materials. It can also indicate underlying issues like hoarding disorder or depression. If you notice your loved one's home is becoming excessively cluttered or messy, consider reaching out to professional organizers or home care services for assistance. They can help declutter the space, organize belongings, and establish routines to maintain a safer and more comfortable living environment. No. 9. Frequent medical needs. Frequent medical needs, such as constant doctor's visits or hospital stays, are indicators that your loved one might need additional care and support. As we age, it's common to have more frequent health issues that require medical attention. However, if these needs become constant and overwhelming, it could signify a need for additional support in managing their health and well-being. This might involve coordinating appointments, providing transportation to and from medical facilities, or assisting with post-hospitalization care. If you notice your loved one is facing frequent medical needs, consider reaching out to healthcare professionals or caregiving services. Medical case managers can help coordinate care, while home health agencies can provide support with medical procedures or therapies. Number 10. Caregiver burnout. Finally, caregiver burnout is a crucial sign that it might be time to seek additional support. Caregiving can be both rewarding and challenging, but the physical, emotional, and financial strain of providing full-time care for a loved one can be overwhelming. Caregiver burnout can lead to exhaustion, stress, and even health problems for those providing care. Recognizing the signs of caregiver burnout in yourself or another family member is essential to prevent these issues. If you feel overwhelmed, consider reaching out to support groups, respite care services, or adult day care programs. These resources can provide temporary relief, allowing caregivers to take a break and recharge while knowing their loved one is in good hands. Caring for a loved one can be incredibly fulfilling, but it's essential to recognize when it might be time to seek additional support. From mobility challenges and memory loss to caregiver burnout, each sign discussed in this video is a step towards ensuring the well-being and safety of your loved one. Remember, seeking help is a sign of strength and care, not weakness. By recognizing these signs and reaching out to healthcare professionals, caregiving services, or support groups, you can provide the best possible care for your loved one while also taking care of yourself. Together, you can navigate the challenges of caregiving and ensure a better quality of life for both you and your loved one. If you found this video helpful, don't forget to like, share, and subscribe for more caregiving tips and resources. You can also leave a comment below with any questions or experiences you'd like to share. Your comments help us create more valuable content for you. Thank you for watching. Stay well and keep caring.